So the next portion of our program today is the lightning talks. This is also sort of like a cruel social experiment because we've taken some of the biggest talkers in our community and we've said that they have to keep it to 5 minutes, and Dave is ready to pounce. We call it the Jaguar. He will pounce on them if they go for much longer than 5 minutes. So enjoy this little moment of reality TV that's coming up next. So really our lightning talks are designed to, we've heard a lot about, we've heard people's personal stories, we've heard about the funding that is and isn't there, and our lightning talks are designed to give us a quick insight into what are the things that are happening in Ohio, in Cleveland, Northeast Ohio. What are we doing? What's going on? What are the opportunities? There's some exciting stuff. So without further ado, I'm going to bring up our first lightning speaker, which is Mary Zoller, the Development Director for the 2014 Gay Games, presented by the Cleveland Foundation.
Thanks, Christy. Hi, everybody. What an introduction. It's true, I am one of the biggest talkers, and I can talk really fast. I only have 5 minutes, so that's good. And 1.5 minutes of that will be a video. But I wanted to thank Phyllis and Max and Elizabeth and Ben for all of the describing the challenges faced in our community and all the great work you guys are doing all around for the city and the state and the region. So Christy said it's my privilege to kick off the lightning talk portion of the program, and this is to share some of the exciting happenings in our LGBTQ community. So I think I'd like to cue the video. Is it ready to run? To talk about one of the exciting happenings this year.
Well, the Cleveland Foundation is really honored and pleased to be the presenting sponsor for GG9.
What made the decision for us, what it really came down to, was the opportunity to have an impact on culture in our region.
We saw GG9 as a great opportunity to accomplish many things, to support economic development, to bring lots of people to Cleveland, and to show Clevelanders what Cleveland needs to be to succeed in the 21st century.
When the Federation of Gay Games chose Cleveland, it wasn't necessarily because Cleveland has such a large and visible gay community, but because this was an opportunity to make a difference in the heartland.
We've been so pleased with the positive response to our grant in support of the Games. We would encourage everyone to get involved, everyone to feel proud, and everyone to support the Games in any way that they can, whether they attend the Games, whether they're financial sponsors, and whether they just play a role in welcoming people to this community.
As a member of the Cleveland Foundation, I'm thrilled to be a part of this event. Cleveland Foundation is so excited to be able to help support this event coming here, and I hope that everybody else comes and sees what Cleveland has to offer because we're a great place.
So as I said, we're talking about exciting happenings. So this year, one of the most exciting happenings in our community is the 9th Gay Games, which is why we call it GG9. And on multiple lists at the end of last year, the Gay Games were rated as the thing to get involved with in this region in 2014. Why? Because here in a region of immigrants, we'll be welcoming people from over 50 countries and people from all around the world to participate in the largest LGBT sports and cultural program event in the world. We already have people registered from 26 countries and 48 states, including China, India, and Russia. So it's going to be really powerful, I think, especially when the Russians march into opening ceremonies on August 9th. Quick background on the Gay Games, for those of you who don't know. They're held every 4 years, same as the Olympics, with cities bidding to host the Games. We were chosen over Washington, D.C. and Boston, so that's pretty exciting for our region. Past cities are San Francisco, Vancouver, New York, Amsterdam, Sydney, Chicago, Cologne, and in 2018, the Gay Games will be in Paris. So we are an excellent company. We have a big responsibility to make this awesome this year. We'll have over 9,000 athletes, which is as many as the Olympics, participating in 38 events with an additional 20,000 spectators. We are so grateful to have the Cleveland Foundation as our presenting sponsor, and as the video said, supporting the Gay Games makes a lot of sense for funders because the Games will have an economic impact on a region of over $40 million, so it really helps our region. Because of the Cleveland Foundation's early leadership, we're attracting large corporate sponsors as well as small businesses, which I'm especially proud of because we really want to help as many businesses as possible, as many people as possible, get a piece of that $40 million economic impact, over $40 million. We're changing hearts and minds, which is good for the civic development of the region, and it's good for attracting and retaining talent, which is good for business all across Ohio. And as the video mentions, one of the reasons Northeast Ohio was chosen to host the Gay Games is to create change and make a difference in the heartland. So leaving a legacy for the Games is really, really important to our organization. It's something we've talked about since the beginning. And we knew we wanted to do this, but how are we going to make that happen? So working very closely with the Cleveland Foundation and also the Gay Community Endowment Fund of the Akron Community Foundation, it's a long name, and John will be speaking next from that organization. We are implementing a community partner program that's really reaching far and wide into the community, and we're creating an infrastructure that will remain long after the games are over. So it's really exciting. For me, I used to work at the LGBT Center. I'm definitely an advocate and an activist, and I just really wanted these games to make a difference. But I have the job of raising the money for the games. I can't always worry about making a difference, in that way. I thought, how is this going to happen? How is it going to happen? And I can't tell you how happy I've been to see this community support unfolding and the way that we are really making a difference and changing hearts and minds. I had a meeting with somebody from a bank who's not a funder of ours yet, and she said, yeah, my son who lives in Washington, D.C., told me that he's straight, and his straight friend, whose straight father lives in Cam's Corners, is going to be a wrestler in the Gay Games. Wow. You guys are really reaching communities if you've got a straight wrestler, some middle-aged straight wrestler from Cam's Corners, which is a neighborhood, So I really feel like we're doing a good job at reaching out to the community, and that's just one teeny story of that. The other neat thing is all these stories, we'll never know what they all are. And I love that too. You want to know all the stories, but it's so big, you'll never know what they all are. We never will, and that's exciting in a different way. So at the close of the games, we'll be launching a new fund with the Cleveland Foundation specifically for LGBT organizations and programs, and that's another really amazing, powerful piece of our legacy. So I wanted to offer all these examples to you as funders and as community advocates to get involved, to inspire you to get involved with one of our amazing local LGBT organizations and get creative with ways to make a difference. Take their mission and your goals as funders and advocates and get creative with ways to make a difference. And real quick, back to GG9, there's lots of options to get involved. You can participate, volunteer, donate, become a sponsor. Anyone can participate. You don't have to be gay. You don't have to be good. You just have to be 18. So that's our little sidebar slogan. All participants will march into opening ceremonies, which will be held at the Q on August 9th. You'll get a participation medal, an RTA pass for the week, and a ticket to closing ceremonies. So we really encourage everyone to get involved. This is a once-in-a-lifetime event for our region. Please don't miss it. Thanks.
Next up, we have John Garfalo, the Vice President of Community Investment from the Akron Community Foundation.
Thank you, Christy and Brian, and appreciate the invitation. I am here not only on behalf of the Akron Community Foundation, but more proudly to represent the Gay Community Fund of the Akron Community Foundation. This was an idea that was born back in 1999 by a group of Akron residents who realized a couple things, that there was definitely a lack of funding for programming for LGBTQ programming in the Summit County area. And two, that there were many, many generous donors who wanted to offer that support, but there wasn't really an avenue for them to do so. So after 2 full years of planning and 2 full years of coordinating with the Akron Community Foundation, the Gay Community Endowment Fund of the Akron Community Foundation was born in 2001 with a $35,000 investment from very generous donors in the Summit County area. I am happy to say that here in 2014, that fund stands just under $1 million that goes back into the Akron community. What they really wanted, and at the time, back in 2001, it was the only fund in the state of Ohio that was specific for LGBT programming, and only one of 20 throughout the country. So the GCEF takes great pride in being one of the founding organizations offering these type of programmings here in the area. They offer nonprofit organizations an opportunity to fund specific programs that deal with LGBT youth, senior citizens, some of the more important social issues of our community, like same-sex marriage, housing issues, so a full spectrum of programming. There's a grant application that is filled out once a year by our applicants. It's a very rigorous process that the board takes very seriously. They look at every grant application, and of course, as all the funders know, we always get many, many more applications than we do dollars to expend. So there are some organizations that we have to say no to, even though they're offering some great programming. One thing that the fund is very proud about, not just the dollars that they invest back in the community, but the fact that they're really impacting change in Summit County. And when I say that, is they will not offer a grant to any organization who does not have in their hiring policy a discrimination policy against hiring people based on sexual orientation. So I've been at the foundation a little less than 3 years now, and I could think of 6 examples of organizations who did not have that policy, including the University of Akron, who did not have that policy, and because of the GCEF, that they were able to inflict that change within those organizations, and each and every one of them changed their policy to include non-discrimination based on sexual orientation. So the fund takes great pride in that. How do they raise their money? They have very generous donors in the Summit County area who each and every year give generously to support the fund, and the first Sunday of each year in December, they have an awesome event, which I'm not sure how many of you have been to the Sugar Plum Tour. Anybody? Some hands have gone up. It's an amazing event, a signature event in the Akron area where it's a house tour of some of the nicest houses in Akron, decorated for Christmas. They get between 700 and 1,000 people who tour the houses on this one specific day, and they raise anywhere between $75,000 and $100,000 that go right back into the fund to reinvest in the community. The fund was a very proud supporter of GG9 because of the outstanding support that the Cleveland Foundation offered to the games. The Akron Community Foundation, as well as the Gay Community Endowment Fund, wanted to step up to the plate as well in ways that have never been done before. I mean, the average grant for the Gay Community Endowment Fund is anywhere between $5,000 and $10,000. But because of ACF support, because of individual donor support, and because of the support of GCEF, they were able to make a $100,000 commitment to GG9 to be the host sponsor of all sports in Akron and Summit County coming up this August, which we're very, very proud of that partnership with GG9. The board is made up of individuals in the Akron Summit County area who are invested in programming and in giving back to the community. So I'm very proud to represent them today. Really should have one of them come and talk about why the GCEF is so important in the Summit County area. But we cannot be prouder to have this affiliation with them, and we worked hand in hand. And not only do we support LGBT issues, the foundation also has a fund that supports women and girls issues, that supports minority issues, that supports children's issues. We feel like we're at the forefront of addressing some of the most pressing needs in Summit County, and we're really happy to be there and offering these programs to our agencies. Thank you.
Thank you, John. Next up, we have Valda Lewis, who is the Vice President of the Board of the LGBT Community Center, and she's also the chair of the steering committee that is working on the Cleveland affiliation for the SAGE program.
I'm delighted to be here. As you can see, I have a couple of nice, fancy, long titles there. What that really means is that I'm a volunteer. So we get to, call ourselves whatever we want. So I've been a volunteer, an advocate, an activist in the LGBT community for many years. And I am currently on the board, the VP of the board of the LGBT Center. And when I first went there, I was trying to think about what I could bring to the board that was missing or needed more. So I took myself off to the National LGBT Conference, Creating Change, to catch up on the national movement, and was looking to see what kinds of programs were being developed and what we could use in Cleveland. And the first day, I went to an all-day pre-conference institute on LGBT elder concerns and learned about SAGE. And that acronym stands for, not exactly, but it stands for Service and Advocacy for LGBT Elders, and that's defined as those of us who are 50 and older. So here was an established organization working on aging issues, laws, and policy at the national level. I learned that they were busy creating a network of local SAGE affiliates, and I talked with several SAGE affiliate directors about the work that they were doing. And I returned with an armful of information and a passionate determination to bring SAGE to Cleveland and to establish a program that would advocate for our seniors. And as anybody that knows me, once I get an idea and I want it to happen, then sometimes the description might be, I'm like a pit bull. I will talk to you, you can talk to me till you're blue in the face to tell me it's not a good thing, and I'll still tell you otherwise. So, but with this particular issue, everybody felt that this was a good thing, and so we immediately put the word out that we were looking for members to step forward for a steering committee to help make this happen. And immediately people came forward. I'm pleased to say we, very early on, several local organizations and agencies involved in aging came on board. We have the Cuyahoga County Division of Senior and Adult Services, the Area Agency on Aging at Hospice of the Western Reserve, the VA Hospital, the Long-Term Care Ombudsman of Northeast Ohio, and Metro Health Clinic, and you'll be hearing from Dr. Ng right after me. So we also attracted a lot of LGBT seniors who had experience themselves in varying care provider issues and legal issues and so forth. So we got a really great working team together very quickly. And our first task was to put out a survey to assess the needs of the local community. And so we worked really hard, and our survey was highly successful. We discovered that other affiliate surveys averaged about 350 returns, and I'm pleased to brag that we had over 1,000 returns on our survey, and so we have some really good data that we're working with. We've held several community meetings and focus groups based on the survey outcomes and have written a 3-year plan, so we're on it. 3 key elements, I should say, to successful aging in any demographic: financial security, good health and health care, and social support and community engagement. So those are the 3 challenges there are additional challenges in all of those areas that LGBT elders face, and unique barriers and inequities. So our survey reported a perceived lack of LGBT medical competency and a widespread reluctance to treat LGBT patients. Now, whether this is real or it's perceived, if this is how people feel, then it's real to them. And so the barriers or the lack of competency is very real. Maybe not in every case, but if the perception is there, it becomes a reality. There's a perception of cultural incompetency in long-term care facilities, a fear of allowing home care into your home, a stranger coming into your home, financial advisors lacking specific knowledge about LGBT issues that affect the finances, and a very strong desire for LGBT social interaction, resulting significantly high reportings of loneliness, isolation, and depression. And the most significant outcome, really, the bottom line, is that most of our elder community do not know where to go to get the trustworthy information, reliable information that they need to even find out about what kind of benefits they may be entitled to. So we're really facing 3 major actions: information about and access to currently competent service providers, both legal and medical; cultural competency training for service providers in both the public and private sectors; and then specific opportunities for LGBT social interaction and communication. So that's where we're going. Establishing a strong program for our LGBT seniors would mean that we could begin to address the barriers and inequities and help our LGBT seniors to age with dignity. So, and one very last interesting fact that I wanted to put out that my partner said in a speech a few months ago, the LGBT community is the only minority that is abandoned by their families. And that has impacts, you know, very much we think about homeless youth, but when you're old and you have no family to advocate for you, the significance of that comes back. And that's all I have to say. Thank you.
Thank you, Valda. That was probably record time for Valda to speak too. You did it, you did it. Next up we have Dr. Henry Ng, the Clinical Director of the Metro Health Pride Clinic.
Good morning, everybody. I have the dubious honor of being the last of the lightning talks and having 5 minutes to sum up everything there is about LGBT health. I talk quickly, but I can't do that. What I can do is I'm going to share just a couple little bits of a story, and then to tell you a little bit about what's been happening at Metro Health and what the things that we can do to improve LGBT health, both in our community and I think nationally. I wear several hats. I'm the clinical director of our Pride Clinic, which is a service line at Metro Health Medical Center focused on LGBT health and promoting healthy outcomes for all people who cross through our doors. And we started as kind of a brick and mortar access point at one building, at one site, and we're trying to make a lot of transformation happen throughout our organization so that any patient can come through any site, any portal, and get the care that they need and be respected. That doesn't happen. When I first came to Metro in 2001, it's been 13 years, and I'm a proud Clevelander. That's one of the hats I wear the most strongly. I didn't think that this would have been the place I settled down and be able to work and do this type of advocacy and activism at a county hospital. We started the first hospital-based LGBT health service in the country at a county hospital in the Midwest, in Cleveland, with the support of people like you who are here and all the people who are watching and listening to us, and so many other people who can't come out, who can't be here just yet. We represent all their voices. We provide them the services that they need in a respectful, honest, caring way when they are vulnerable. We all become vulnerable when we need health care. Think about the last time that you felt really lousy and you had the flu or a cold or a cough, or someone had a breast lump, or someone found something abnormal about their body. We're panicked. We're scared, we're afraid. Those are natural human reactions to the unknown. So we enter a health facility and we negotiate with a health provider who has a white coat who doesn't know us. But we put faith in that relationship that this person, this nurse, this doctor, this PA, this health professional, is there to help us. But unfortunately, we find that many times that person isn't completely helpful. That they might be judging or discriminatory or simply insensitive. The National Transgender Survey and Justice at Every Turn in 2011 identified that more than 1 out of 4 people who are transgender are refused care by a care provider. That 1 out of 2 of every patient cannot get health care because they cannot afford it. That 1 out of 2 patients have to teach their providers about elements of their basic health. Imagine if you have a hypertensive patient, someone with high blood pressure. You have to go to your doctor and tell them, this is the medicine I have to take. But transgender people do that all the time. We have a health system, unfortunately, that isn't well structured and well trained and well educated yet to meet the ever-growing diverse needs of our community. But in Cleveland, the gayest place on earth, at least I think so, next to Disneyland, we have been able to do this. I mean, just think about the marvelous, amazing things that are happening in this community. And again, the Pride Clinic in 2007 was founded by the community it serves and named by the community it serves. And we're providing primary care, mental health, transgender hormonal health, comprehensive referrals for patients who are coming through our doors for whatever reason, and we meet them where they are. We're so proud to be able to do that, and I'm very proud to be under the leadership of our executive, our CEO, Dr. Akram Boutros, in order to do this work. So we have been seeing hundreds of patients throughout the Northeast Ohio area, and patient care is a big piece of what we do, but also education and training is another important part. As I've mentioned, we have a workforce that is not necessarily fully prepared. When medical students and other types of health professional students don't really know what sexual orientation and gender identity are, that's a problem. So we have the opportunity to provide education and training for all those individuals from many medical schools and health professional schools, and do research throughout the Northeast Ohio area and beyond. We're very excited to continue to provide services and develop new things as the community asks us for them. A couple of years ago, we ended up developing a pediatric endocrine service line to help children and their families who experience gender variance, aka trans kids. We didn't have the service when we started. It wasn't on our radar, but it was something the community asked of us. We have patients coming from all over the state and out of state in order to help to have their health issues addressed and met. So we have a lot that's on our plate as a health institution. I have a lot on my plate as a health provider. I have a lot on my plate as a leader in LGBT healthcare and health and health disparities. But I think that there's a lot of support. I think that there are a lot of resources, and I think there are a lot of opportunities to collaborate and to move forward. I don't believe that anything happens by accident. All this work and all this progress has happened because of the combined efforts of all the individuals in this room and out of this room and all the people within earshot. It also happens by providence. So I invite each and every one of you to consider what you can do to improve equality for LGBT people and also health equality for LGBT people. Thank you.
Thank you, Dr. Ng.